So I recently made a video for patients giving them tips on how to make their visit to the dental office a lot better experience. This video is going to be for dentists, or at least those new to the profession, to help them make patients more comfortable as well, and honestly the rest of the staff as well. The first one on my list is actually the one that was the bonus tip for the patients last time, but I think this is a really good one to have at the top of the list for those who are new to dentistry, and that's to listen. Listening to your patients, I think, makes them feel a lot more comfortable and makes them feel like they're heard as well. And I think that really improves the potential for the relationship between the patient and the doctor. I've had experiences in the past, for example, when I had a patient in not long ago for a toothache, and they were describing to me that it only hurts when they chew on it. And I said, okay. So I started going through my list of other questions that I'll typically ask, like, hey, when did the pain start? Was there a traumatic event? Is it sensitive to cold? Other things, and I actually made a video about things to talk to patients about regarding toothaches and what patients should know about toothaches too. If I can figure out how to put a link to that in the video, I'll try to put it up here in the corner. But I was going through my questions, things that I would ask a patient. And he would answer my questions, but he would add on. Every time he answered my question, he would add on, but it only hurts when I chew. And after the second or third time he repeated that, I realized, oh, he thinks I didn't listen to him. So I repeated it back to him. I said, okay, I got it. It only hurts when you chew on it. I'm going to ask you some other questions now so I can get some more information about what's happening. So I made sure to repeat back what he said so that he felt like he was heard. And I think that makes a big difference for patients. So if you have that experience where they seem to be repeating the same thing over and over again, they may not feel like you heard them. So make sure you acknowledge that you do understand what they're saying. And in general, it's good just to listen to patients, because the second category is if you notice other problems, make sure you address their concerns first. For example, if you're doing an exam on a new patient, they might come in complaining about a chipped tooth in the back. You might notice that they also have gum disease, they have some old fillings that are failing, but you want to make sure before you get into all the other things you're noticing that you address their primary concern. Don't neglect what they were trying to tell you from the very beginning. So that's the second tip I have for you that kind of jibes with the first one. The third tip I have for you is explain what you're doing as you go along. I've had so many patients tell me that they appreciate how I explain what I'm doing during the procedure. For example, if I'm doing a filling, I'll say, okay, now I'm drying the tooth, now I'm applying the primer, and that's got to sit there for 20 seconds. Now we're going to apply the adhesive, and that has to sit there for 10 seconds. And it's very mundane stuff. It's boring. Between those steps, my assistant and I might chatter about certain things and, make the patient feel included while we're chatting. But I explain what's going on during the procedure, and I've had so many patients tell me that they appreciate that. I started doing that because I looked at it from the perspective as a patient. When I go see the doctor, I like to know what the heck is going on. So I take that same approach and I explain what I'm doing to the patient. Almost everybody tells me that they appreciate that. I do sometimes tell people if I can tell they're anxious, I'll say, hey, if you don't want to hear the details, just tell me to be quiet. And I have had a handful of patients over the years tell me, yeah, just do it and get it over with. So I'll stop talking. But a lot of people appreciate that. So that's a good tip you can do too. If you're liking this video so far, be sure to drill down on that like button. It really helps me out with the algorithm, makes my video a little more visible. So thank you for doing that. All right, moving on. The fourth tip I've got for you, give a clear diagnosis before you start actually getting down to the treatment of the day. So if they're in for a filling, say, hey, we're doing a filling on this tooth and it's going to be a white color filling and we'll be done in probably 30 to 40 minutes. Then you can get started and answer you can answer any questions they might have before you begin, and then it makes life easier for everybody once everybody knows what's going on and we're all on the same page. So that's a good thing to do, is give a clear diagnosis of what's going on. And I should have been more specific. If you're doing a filling, explain why. There's a cavity, there's a crack, something of that nature. I think it's easy for us to get bogged down on what the procedure is. And many times patients want to know the why, and this is probably a topic for a whole other video, but I do think we are shortchanging ourselves in dentistry by not also using diagnostic codes like they do in medicine. We pretty much just have procedure codes. We don't do a diagnosis and then a procedure. Even though we're doing a diagnosis, it just kind of gets forgotten sometimes. But that's a whole different topic for another day. All right, the next tip is to establish a way the patient can communicate to you during the procedure to either stop or interrupt you. So if I'm getting ready to do something for a patient, I will say, hey, if anything bothers you during the process, or even if you just need to take a break, raise your hand and I will stop. If you establish that in the beginning, I feel like, I don't have any data on this, because this is all like my personal opinion here on this video, not providing any scientific data on this one. This is totally my experience and professional information. But I feel like if you establish a procedure with the patient in advance, they're going to be less likely to panic and or grab you while you're trying to work on their teeth or their mouth. So I would establish a protocol in advance. What I do is I just have them raise their hand, and the first time they do it, they're like, oh yeah, that totally works. So then they'll feel much more comfortable going forward. And sometimes as soon as you say that, they'll raise their hand and be like, yeah, let's get out of here. Next tip I have for you is to provide eye protection for the patient. I don't know where this came from. I'm always curious. I've never really asked any patients about this, but so many patients, when you lie them back in the chair, if they already have glasses on, they'll take them off because they think the glasses are in the way. And I don't know why or where that came from, why people think having glasses on gets in the way of us checking their teeth. You should totally have your patients wear safety glasses. Glasses don't get in the way of us checking their teeth. Glasses do get in the way of anything going in their eyeball, which sadly happened. If you Google dental patient getting poked in the eye, you'll find stories. There's one that shows up right at the top about a patient getting poked in the eye with a used needle. I guess they had given some anesthetic and they had recapped the needle, and then perhaps they needed some more anesthesia for the tooth. So the assistant loaded another carpule of anesthetic in it. They were handing it to the dentist, and apparently they were handing it to the dentist over the patient's face, which also is a bad thing to do. And it slipped and fell out of their hand and went in the patient's eye. Patient was numb from the anesthetic, but as soon as the numbness wore off, they were in significant pain due to the infection that was inserted in the eyeball from the used needle from the mouth. And so, yeah, you should absolutely 100% have your patients use eye protection. Some patients will complain because they don't like change, but tell them the story and encourage them. They definitely need to be wearing eye protection. And in conjunction with that, do not pass instruments across the patient's face. That is kind of my next tip here. Pay attention to what you're doing with your instruments. If you pass instruments between the assistant and the doctor, do it, it should be down here or up here, not across the patient's face. That should not be happening. Also, when you have the instruments in the patient's mouth, don't rest your mirror on their gums or something to that effect. That's just not a pleasant experience for the patient. So don't do that. Just pay attention to what you're doing with your instruments. And then the last tip I have for you is to be kind and patient with your staff in front of patients. If you lose it on your staff in front of the patients, it doesn't make your staff look bad, it makes you look bad. And to be perfectly honest, if your staff messed up, either you didn't train them properly or you didn't communicate with them properly. That's on you. I would not use your mind in front of a patient on your staff. So just remember to be kind to your staff and keep in mind that there is a potential that maybe you had the communication error and not them. All right, so that's all for tips for dentists, for new dentists. I hope you enjoyed that. I know maybe some patients didn't really watch the whole video, but hey, maybe somebody found that helpful. If you did, make sure you hit like and subscribe, do all the YouTube stuff, and remember, remember, smiles are contagious.